Hello, everybody. My name is Nathan Nipper. I'm the President and Chief Executive Officer of UNC Health Appalachian. Thank you so much for taking time to join our community summit today. Um, I know there's a lot going on right now. We want you to know what's going on around here. The goal is transparency. I want to talk a little bit about where we've been over the last year, where we're going in the coming year, and a few updates that affect you and your families. And we're really excited about what's ahead of us. Um, I will say that uh, the filter that I use really relates more to my daughter, of all people. My daughter recently took a job at Memorial Hospital in Savannah in a trauma unit, and eventually I think she's going to go to the ER this summer, which I'm really excited for her future. But when she went to another facility, and I don't know much about HCA, I don't, but I always hope and pray that that executive team takes care of her, and it means a lot to me. Her name is Emily. I call her Bean. I've called her Emily a couple of times, like at the doctor's office or something, but she's Bean to me. And so I call that my Bean principle. When we make decisions or when I make decisions and someone's asking me a question, I always reflect on what I would want her executive team to do. That means a lot to me, and I hope it means something to you too. It's it's something that I reflect on constantly. I want to do the right thing by you. You have people that love you. There's family. There's people that I'm also responsible to on the outside that are hoping that I do the right thing for you and for your families, and that matters to me. It's my being principle. It's the filter that I use personally to make decisions about where we're going in the future. Um, so thank you again for joining us, and we'll roll through this. I'll mention first of all, without even going to the agenda yet, that our employee assistance program is one of the best that I've ever personally seen. The leadership of that organization has given us so many options that we can use to support you and your immediate family through crisis. Um, Resilience isn't about getting back where you were before, but coming back even stronger. And Lord knows we have been through the mill with hurricanes in the mountains and now wildfires. I had an employee ask me the other day, when's the Lord going to give us a break? And don't know when that's going to come. But I'll tell you this: you've got people that really appreciate you and respect you and your families to help you through this. We have a strong EAP program as well as our employee-to-employee E2E program to support you through any financial crisis too. Hopefully we can help you there too. So please reach out if you need something there. I highly encourage that. Our agenda today is really talk about our values and our scorecard, where we've been this year, and then lean forward a little bit in 2026, what we're planning for next year, a few things that will affect you and your families that we're excited about. Um, just to touch on community engagement, and then we'll close on a few points. Now, our values, we've talked about these for some time now, and I will tell you that most any organization, hospital, church, school, family, really can lean on these four basic principles on how you treat yourselves, how you treat your your colleagues, and especially how we treat our patients. But these are principles that you can live by, which I really highly respect the organization for putting these out. Just a few things on this. One great team is all about working together, especially in your own departments, truly, but also across departments. Even a simple lab draw can be a very harrowing experience for somebody coming into the organization. It passes through a lot of what we call departments, touches a lot of hands. By acting as one great team, we can calm people's fears and make sure that we know we're doing appropriate handoffs. They know they're in the right place. Carolina Care Service, guys, you're doing a great job. I've been so amazed in the last couple of years that I've been here, how well we're doing with service. And we're not happy with anything, right? We're going to keep advancing, doing better and better. And I like our momentum leaning forward into the future. Leading the way, and just things like the robotics program. I'll talk a little bit about the cardiac CT program we're developing. Our technologies are advancing harder and harder. I think between those middle two boxes, we've got quite a future competing on service and high touch technology. You don't see the things in rural organizations the way you see them at Watauga Medical Center and Cannon Memorial. We're doing some pretty groovy things out there, and we're proud of those, leading the way. Starts with me. We've got individuals here that I've never seen anything like it, that really take the lead in doing things for their new employees, their employees that have been here for a while. Um, taking the take Starting with handling patient situations, taking it upon themselves to take the next level of care. We've got several examples. For instance, I've been talking about Jamie Ellison up at in Periop, how she brings new people into the organization, um, leads them quickly into being productive parts of what surgical services is all about. And I've heard nothing but accolades of how she keeps her people connected to what's going on in the organization. And I know we've got tons of examples like that, but that's just one that came up the other day that I was just so proud to hear. Thank you for taking the moment to go through the Learning Map experience. We had several channels to go through with this. We had Learning Map experiences that were coached and mentored. I was in a couple of those, and modules experiences. And I really have to say, Caitlin Zirkle and her team did an amazing job of setting us up. How can you get 55 or so of these in-person learning experiences set successfully, and the ones that I facilitated anyway were packed, and which was great. I, as a facilitator, really enjoyed doing it. So thank you again for going through this. It's going to make us better. One point that I have been making is forces of change. When you look at the picture, I'll be referring to these off and on as these forces of change blow through our solid values. We have to respond to things. We've got regulatory pressure for sure, financial pressures. Any healthcare organization is going to continue to have that. Changing consumer expectations. We've got so many things that are blowing through our organization we have to respond to, and we have a good plan for all those things. Let's reflect a little bit on where we are with our scorecard. For the year to date, this is our metrics for operating performance. I'll quickly go through these things. The blue dots mean we are overachieving from where we set the target. Um, we we didn't sandbag. These were stretch goals for us when we set them, and fortunately we've had several overachieving, that's what we're calling overachieving in our goals, and the green dots mean we're meeting those thresholds. So we talked about learning map exercise. Year to date, I would say we're actually closer to 70% performance right now, and our target was just 50%. We were happy with that, and of course, Appalachian takes it a step beyond, and you were doing great. Length of stay is staying well below 4 days, which is really where we need to be. A couple of years ago, we were close to 5 days length of stay, and that just had to be lower, and we're doing great, very, very consistent along those lines. In our quality metrics, we're doing very well. You see our mortality index is being tracked, and you can see depression screening follow-up. Also reflecting back to our emotional needs of our community. In the bottom right-hand box, you see quality outcomes, and we're doing very well across those segments of our metrics. Um, we do have plans to go forward with readmissions. That's an area that we stay concerned about. And the other area is sepsis order set. There's always something to work on with sepsis. That's been around for a long, long time, but we've got good plans to how we're going to handle that. Online scheduling. That reflects our ARMA practices and how well our patients are getting online and scheduling their own appointment, making it a little bit easier on how we schedule, and it makes it convenient for them. We've already seen vast improvement going down to the last line there of our Press Ganey medical practice overall satisfaction, and we're blowing it out of the park right now. And couldn't be more proud of that. We've come a long way. The Epic access has been a huge advantage. And of course, our HCAPs. We'll talk more about this in the next slide, but we are well meeting threshold for those things. This quick slide refers to where we are with overall UNC Health, and you can see the UNC Health hospitals along that y-axis there in alphabetical order. You see Cannon and Watauga Medical Center highlighted. across the rows, we're going to go briefly across these. We talked about age caps already. So now, as we sit here, we're at 85th percentile when it comes to the rank on Watauga Medical Center. Canton being at 42 only reflects that we just don't have many returns from there. We do have email surveys that will be done, so that should help Canton for sure, and get a more immediate access to all our surveys. ED, our merchant department performance has been outstanding. That's just traditionally Canon. They've always led the nation in consumer satisfaction there. And Watauga's doing much, much better than where we started. I really have been really proud of how our medical staff leadership has been. Dr. Pearson, Dr. Rogers, and Christy Haynes, but before her, Kathleen, doing a wonderful job of just keeping the group together, keeping them inspired. I think we're doing the right thing there. And of course, the groups that support that, lab, radiology, and patients respond to that, don't they? The and of course, our medical practice on the far corner there, we talked a little bit about that. But coming back to the next to last column about surgery, that's outpatient surgery. Who would want to go to Canton for an outpatient procedure? I mean, that they're also leading the nation along those lines. And Watauga's come a long way too. I think going back to what Jamie Ellison and Heather and her team are doing, are making a huge difference. If you notice, by the way, the numbers going from 93 top box, 93% top box, to Watauga's 90% top box is that much different in the ranks. That's a very competitive group for us. Key operating performance, and these are volumes, by the way, and I'm not going to go into detail about the number. What I will say is when you look at the blue bars right in the middle of the page, those represent months in this fiscal year. So the two tall trees you see there to start the year, that's July and August. And then it rained. Then Helene hit, and you can see we've had trouble getting back to even where we were in July. It's coming, y'all. I have full faith. This month feels a little bit better already. We're hearing some good feedback from our ARMA practices. So more to come on that, but good things ahead with our volume. We're just trying to get back to where we were this time last year. This is the outcome of that. So when we lose volume, of course, net revenue leaves us. And it happens in any business. Volume's everything. And we didn't want to cut expenses so much that we rode this out on the backs of our people. So we did lose about $6 million in net revenue. And that's where you see the budget variance on the far right, that orange bar going below zero. That's where we've missed budget by about $6 million. And that's a pure reflection of how we lost it in Helene. And we will be back. No doubt about that. Let's go to brief service updates. Now, there's several things. Obviously, lab services is top of mind and our pricing. We've heard loud and clear from the community that we need to be more competitive, and we're looking at every possible way to compete with those ambulatory practices. More to come on that. It's just a difference of site. Hospitals have to build things differently than ambulatory sites of care. That's what we're struggling with, and we'll have some solutions for this. Going to cardiac services, we've got the CT, the cardiac CT will take us next level. That's basically a cardiac cath without necessarily having to be invasive about it. It is very near a very true test to a cath. We'll be starting this over the next couple of months. Dr. Atkinson will be leading the way on this. He'll be reading these studies for us. Robotics-assisted surgery. We've done about 270 so far, and general surgery has been our true pioneers with it. We are recruiting for GYN and urology. Pain management, Dr. Nguyen will be here in August, and we'll restart that where Dr. Stork left off. But very confident that there's people that are leaving the mountain for this care. We don't have a spine surgeon right now either. That weighs a good bit into it. Spine could very well be our future, but for now, getting that pain management practice will be crucial to our performance going forward. Very exciting initiative is ambulance transport. Now, we've struggled over time with our local 911 service here in this county and in Avery. It's just been difficult for them to provide ambulance service outside the county to get our patients to a higher level of care. We're going to take it upon ourselves to provide this service. We send hundreds of people out every year, and also it would help us to bring people here. We feel like we're losing volume from other counties that that have the ability to pick up patients and take them somewhere else. We can play that game too. And so Greg Miller and his team's done a great job of pulling that service together. So by this calendar year, we will definitely be in business there. In behavioral health, the idea there is to just keep ARBH at capacity or near capacity if we can. They had a bit of a dip, but we will get them back to 27 patients very, very soon. Surgical capacity between here and Cannon Memorial has been worked on. So we're trying to clear capacity at Watauga Medical Center by sending more of these patients to Cannon, and we've got a beautiful plan for that. Women's services, we have a new OBGYN starting this summer, Dr. Steele, and we already have good access now in our women's clinic, which we couldn't say a few months ago. We've added some providers there and midwives. We like our laborist program. That's been very solid. And weaving in some of the resident program with that as well. So we're still working hard with this. We know that GYN will be the next level. We have somebody here that can be robotic trained. Mobile MRI is an initiative that we've worked hard on a CON with. That in 2026, we will definitely have that project underway and working. It'll provide ambulatory access for imaging, which right now we do not have. We know at Cannon this will be helpful, and other places such as App State and other places that we can provide a doc. And we're going to take care of this region with MRI on a truck. Cancer Center is always in the back of our minds. We are recruiting for 2 medical oncologists and radiation oncology. So we actually have a plan now we're actually working on moving our medical oncology over to the imaging center, or you all know it as the imaging center across the street. And we'll have 10 exam rooms versus today we have 5. We have 5 exam rooms for 4 providers, and that doesn't work out in the math. We'll be better off very, very soon. And part of that is to consolidate our infusion between the hospital and the cancer center in one place. So we'll have over 20 chairs, plenty of capacity, and a well-lit environment that I think our patients and visitors will appreciate. Satellite subspecialty. A very good concept. There are 3 specific areas. I think gastroenterology, women's services, and cardiology lend itself to advancing in both counties around us, Avery and Ashe. We have space. We have the providers. We just haven't done the initiative of putting them in the right place consistently and pull volume to us. Amanda Williams and her team are looking at that right now, and I suspect we'll be doing that before long. All right, people services, things that affect you. Now, there's a couple of things, surveys. Now, we've heard loud and clear that our people on the front lines want to be a part of decision making. Well, it's your turn. You're up. We've got a couple of surveys coming out this month, and we need your voice to make sure that we're headed in the right direction. Culture of Safety Survey has come out. It came out on this past Wednesday, April the 2nd, and then it'll be open for a month. We would love to have 90% of our people take this. The more people take it, the better. We've got a goal of 90, so let's hear it. We want to hear your voices. We can do a lot of very positive change when we feel where you think we need to be looking to make you feel safe, that you are delivering safe patient care, and that your voice is heard consistently. You are a part of the care team. We need to hear from you. Benefits. Now, we've had generally the same benefits package for many, many years. We need to ask you what you really want. And on April 14th, there'll be a survey coming out as to what your priority needs are for benefits and what you feel like is the right thing for yourself and your families. So by the time we have a new benefits package this fall, we're making appropriate changes and modifying that to customize it to where our people really want to be investing in benefits. So please, those 2 surveys are very, very important to us to make sure we're doing the right thing for you. Again, going through that bean principle, we want to make sure we're hearing from you. Certain events are coming up. We got night shift meals coming up later in the month, so be on the lookout for those at both Avery and Watauga campuses. Organizational-wide salsa competition, which is not a dance competition, as I've been corrected many times, on Cinco de Mayo, and we're going to have some fun that day. And it lends itself to our Nurses and Healthcare Week the following week, May 11th. We'll be doing a little bit less events that week. We heard loud and clear that maybe hold off on the events and give us a gift. Give us something that we can, have in the community. We're going to be doing that. So we'll be doing a gift during that week and spreading our events out throughout the year. So the salsa competition and other things throughout the year can be enjoyed by our whole Appalachian team. And also coming in May, we'll do an employee provider town hall. So let's get to the compensation updates. There's been a lot of talk around this and a ton of work. High praise for Alicia Price and our CFO, Rick Cassidy, for working on this together. Talking about one great team. We really need to make sure we're doing the right thing along the compensation element of our organization. We know now for several years we've had challenges with this, and, maybe being slow to come out of the pandemic. We've got get our legs up back under us. So we had a third party come in and do a very full market analysis of what we can be doing better, and we've got the results. It'll be nearly a $4 million impact to our budget next year. Alicia has done a great job of getting out to our department leaders to educate them on what it means. And later in April, after our board approval, there'll be some individual meetings as to what it means to you, which that's what we're looking forward to doing. But we need to go through the budget process, make sure it fits in the budget, get the board approval, and then we can go forward from there. And by the way, we've got a lot of touch points in the community. I can't say enough for the talent we have around here. Got three daughters. My younger two are at Caldwell. We're just fascinated by the education we have around us. We want to keep our talent here. And better yet, we want to keep our talent here and train them to stay. That's what we're aimed to do. The bullets below recognize we have 25 new nursing graduates entering into our nursing services. We want them all to stay. That's the idea. We want to grow our own. Very excited about our future and ability to do that. And also 5 new physician residents to join our family practice residency this year through Mayheck. Sky's the limit. Most of the physicians through that program tend to stick around in the high country, which we really appreciate that. So we're working hard with our local schools and making sure we do the right thing there. In closing, I'll say if we're continuing to hone our values and do the right thing by our people and invest in ourselves, then we're going to be just fine, y'all. We're going to thrive in the coming year. So just in closing, what's important, and please know, I know this is a video, but ask Nathan and good old-fashioned email if you have questions. Please let me know. If you have questions about this, I know I went through this incredibly fast. Please ask the question. If I don't know, or if we don't know what's on your minds, we can't address it. And we want to do that. And I can't walk around enough to ask people how they're feeling about things. Your honesty means everything to me personally, and it means a lot to us as an organization. Coffee conversations are, I've gone to these, and one specifically, we actually have our executives go into this. We do it routinely. Please come to these. I get a lot out of it, and I know our executive team does. We sit down eye to eye and we talk about what's going on. We bring back nuggets to executive team, and we work hard to address any concerns on your minds. Walk your shoes is another example. Y'all tell us what's going on. The more we know, the better. The surveys that I mentioned, please keep those in mind. May 13th is one I haven't mentioned. Meet the Robot and the Surgeon. We'll be across the street over at the Health Sciences School. We'll bring a model of the robot, play around with it. The video game crowd will love it. I had a little trouble with it. I'm an Atari man. But it's so much fun, and actually, meet the surgeons. I can't. We are so blessed to have our general surgeons. There's such a great group from a layman's point of view, educating us on what these machines can do and how they assist. Right now, y'all, we're seeing patients that we would normally send away off the mountain, and we're treating them now, and they go back. They go home next day post-op. It's absolutely phenomenal. EAP, keep that in mind. Keep others in mind around you. Be good to each other, everybody. It's going to be a very bright future for us. We're going to thrive in the coming year. Let your voice be heard, okay? Y'all take care. Thanks so much for your time. Bye bye.